by just asking you a question this morning, and that is, think of the last number of times you've been to a hospital or a clinic or a doctor. And how many times did you ask or learn about the price of the service that you were about to receive? Let me see a show of hands before you got it. Okay, that's one. How many of you asked about the quality measurements or outcomes of the procedure or treatment that you were about to get? One. Okay, so that kind of typifies what I want to talk to you about today. I want to talk to you broadly about the strategic future of Minnesota and the things that are most important to positioning Minnesota not just to survive but to thrive in a hyper-competitive global economy. But before I get into the details of that, I want to just talk to you about government's role in that more broadly and government structure more broadly. I think most of us in this room, or many of you in the room, would agree that when you have markets, you have price and quality transparency, you give people financial incentives to make wise choices, and then there are incentives and consequences for good outcomes by both the provider and the consumer, that those kinds of models work better than the models where you drag into government, can create a non-market oriented system, namely a bureaucratic system, create a top-down command and control, one-size-fits-all, a bureaucratic government employee staff-led organization. Those two visions, those two worldviews, if you will, are really a summary of the competing visions for the future direction of Minnesota and the future direction for our country. Now, to put it more bluntly and more simply, if you really want to know about government reform and how government needs to change, one option for you is to go get some white papers from various think tanks. You can stay up late at night watching cable TV shows if you like, if you've got time to do that. You can go to some conferences. All of that is good, and if you've got time, I encourage all of it. But all you really need to know about government and government reform is simply this. When you go to a wedding, if you see a wedding where there's a cash bar, and you see a wedding where there's an open bar, people behave very differently. So if you just take that memory, that image, if you will, and now apply it to government, you now know all you need to know about how we need to reform these governmental systems. Any system where consumers don't know price, consumers don't know quality, where the provider can provide this good or service endlessly and only gets rewarded either for years of service or volume of service provided, and the bill mystically or magically gets dispersed by going somewhere else, a system like that is highly likely to fail. Unfortunately, that's most of how government operates. And so the road ahead is both exciting and challenging, and before I talk to you about that, I'll just talk to you quickly about the road behind over these last 8 years. Minnesota dramatically needed reform. I like to tell people outside of Minnesota, I love my state. It's a beautiful state. It's filled with really good people. But let's face it, politically, it's leaned pretty hard to the left over most of its modern history. So you have a state from 1960 until 2002, when I became governor, ran up its average 2-year spending increase 21%. 21% for 40 years every 2 years. That is unsustainable. That is reckless. That is irresponsible. There's no way that math works. It certainly doesn't work now when the private economy is hardly growing at all. And it didn't work back in the good old days with 3% GDP. You can't have a spending line on the chart that's growing like that, and a revenue line that's growing at all is growing like that. Those two things don't work. It's no longer a matter of rhetoric on the right or the left. It's a matter of junior high math. We also had for 40 years, and by the way, we've slowed that down now to about 1.9% or so a year annually to get it down to something more sustainable. As was mentioned during the introduction, we also had 40 years where the governors, dating back to Rudy Perkins, including Rudy Perkins, saying, can we at least move Minnesota out of the top 10 in taxes? We're always, second or third or something like that. Strategically, at least send the signal that we're moving in the right direction, if only nominally. And no governor ever did it, no legislature ever did it recently. We did, and I'm proud of that. We've done a number of other things in terms of demanding better standards for schools and performance pay for schools and moving towards market reform in healthcare and trying to reduce and eliminate junk lawsuits and a variety of other things. But I want to talk to you today about the future. As I travel Minnesota and talk to people, the number one issue in this state, of course, is the economy and its jobs. And so people, understandably, are very concerned about whether they're going to have their current job, whether their children are going to have a prospect for a good job in the future, whether their friends or neighbors or family members are going to have a job. That is central to why this Chamber of Commerce in St. Paul exists. And thank you for existing with that purpose in mind. People love to talk about the Minnesota quality of life. I do too. We should be very proud of it. We lead the nation in just about every category. We don't lead it, we're top 5 or 10 in just about everything that matters, whether it's education, healthcare, the outdoors, down the list. But if you ask people, what do you like? What do you love? What brings you the most meaning in your life? They'll most often talk to you first about their faith or their family, but then shortly after that, they'll describe a series of experiences or activities that bring them great joy. And some people might say, Governor, I just love to go out duck hunt. I'm going to go out duck hunt here this weekend or coming up soon, and I love to do that. Other people might say, geez, I just love the Vikings. I love going over to the Metrodome and tailgating and getting the tickets and going to watch the Vikings hopefully beat up on the Packers this Sunday night over there. That'll be in Wisconsin. Hopefully they'll win. Other people might say, I'd love to get up north, I'd like to go outdoors, maybe I'll finish my basement. Whatever the list is, if you look at the list, you will pretty quickly see that almost every one of those activities has a common theme or requirement to it. You know what it is? Money. And for most Minnesotans, their pathway to a quality of life means they got to have. One of the best things that we can do as policymakers, community boosters, Chamber of Commerce advocates, is to say, or ask and answer the question, what are those things that we can do to make it more likely, not less likely, that jobs are going to grow in our state? And the answer to that question, with all due respect to my legislative colleagues and friends, doesn't typically reside in the politicians in St. Paul or Washington, D.C. Most of them have never had a job in the private sector, frankly. Many of them don't. The answer resides with the people who actually do it, with the people who actually have done it, the people who have taken risks, the people who have started businesses, the people who have decided to deploy capital, add employees, build buildings, buy capital equipment, conduct research, and commercialize that research, hopefully locally. And when you go ask them, what can we do to make it more likely that you will succeed? What can we do to make it more likely that you will grow jobs in St. Paul or in Minnesota? There's a consistent answer to what they tell you. And it mostly isn't what you hear coming out of the sandstone building a few blocks up the hill or in the campaign, certain aspects of it. What you hear is this. Number one, Governor, I got to have my costs be competitive. You can't continue, or not you, but we can't, continue to add costs in a hyper-competitive global economy that knock my competitiveness out of line with other states, other countries, or my competitors in the private market. So on the issues of taxes, on the issue of workers' comp, on the issue of unemployment insurance comp, on the issue of energy costs, on the issue of permitting and regulation, the time and money that goes into that, on the issue of any other sort of mandate that government puts on, please, Governor and legislature, make those burdens lighter, not heavier, particularly in a state like Minnesota that's high as a starting point in the discussion. I was in the legislature for 10 years. I was majority leader for 4. I've been governor for 8. I've studied this data endlessly. I know it well. No fair-minded person can look in any depth comprehensively across the country and conclude that Minnesota's major problem compared to the other states in the United States of America is that we're undertaxed. That is not the case. So one thing I've said as governor, and I hope the state continues on this path, is we are taxed enough. And we're drawing a line in the sand. And over time, we're going to reduce it. Over the last 8 years, we've reduced taxes net about $800 million, but it's not enough. We've got to continue to push taxes down in this state to be more competitive and, frankly, draw more jobs and businesses in. Now, this is not the rhetoric of a politician. The Chamber of Commerce statewide did a survey recently, and they asked businesses, What are your two biggest concerns about growth or impediment to job growth as you look to the future? Number one was cost, what I just described. And number two was healthcare costs. Another cost issue, but a slightly cousin of cost more broadly. We're just talking about it at this table. All of government, whether you're at the local level, the school districts, whether you're at the county level, whether you're at the state level, whether you're at the federal level, one of the main driving engines of costs that are out of control is healthcare costs. It's also true, by the way, for families. It's true for businesses. As a nation, we collectively and individually, we have to get healthcare costs under control and make them more affordable. Unfortunately, the nation just passed a piece of legislation that I've dubbed Obamacare that I think goes in the wrong direction. It is a government-centric model. It is the solution that I described to you earlier that is misguided, where they're going to drag a program into Washington, D.C. They're going to create a government-run, government-mandated, government-administered program that I think is going to be a dramatic failure on a lot of fronts, including it is going to make healthcare more expensive, not more affordable, for all of the groups that I just mentioned. If we want to fix healthcare in the country, to get back to that starting point, we have to say to individuals and purchasers, we're going to get in your hands easy to use, user-friendly information about price and quality. If you're disadvantaged, we will give you help as best we can afford it, but the help is coming to you directly. It is not going to be run through some mindless bureaucracy in Washington, D.C. You can then make choices in a marketplace about how and where you want to get your health care, and you will be incentivized financially to make wise choices as to how and when you consume those goods and services. What does that look like in the real world? Well, in the real world, Minnesota has amongst the highest percentage use of health savings account in the country. And guess what? They work. Why? Because people have some incentive to more wisely manage their health care. They're not for everybody, but for the group it's appropriate for, they work. Number two, we said to our state employees, hey, look, your costs are going up, our costs are going up as we try to provide you health care. We have to have a new system. And the new system is if you choose to go somewhere for your health care that is more expensive than most other places, increasingly now measuring quality and lower in quality, then you're paying. And if you choose to go somewhere that is of higher quality or equal quality but is more efficient, you'll pay less. All of the state employees, or nearly all of them, about 90%, have migrated to providers that are more efficient, and the quality outcomes have been maintained or improved. And the impact on premiums and costs has been dramatically lower. Why? Because individuals now have some skin in the game about how and when they consume their healthcare services. Like everybody in this room, except the 2 or 3 people that raised their hand, when I go to the doctor, when I go to the hospital, what do we all do? We consume as much healthcare as our doctor wants to give us, and the more he or she gives us, we feel better treated, don't we? Measured by what? Volume. What should we be doing? We should be measuring what we want the outcome to be, namely better health quicker, and better health more efficiently, and align the money to those outcomes. That is not the current system. Not in Medicaid, not in Medicare, not in most insurance products, not in most of the marketplace currently. And so one just last point on healthcare, most of the money is in 5 chronic conditions. It's in diabetes, heart disease, cancer, obesity, and end-of-life issues. Where you go get your care, if you have one of those conditions, matters a lot as to your healthcare outcome and how much it's going to cost. And guess what? There's a positive correlation between positive outcomes, better outcomes, and efficiency with these providers. So getting people who are consumers that kind of information is a powerful tool if we have a marketplace and there's financial incentive to use it wisely. So number one is overall, let's get our costs under control as measured by taxes and other healthcare costs. Number two, we have to fix the healthcare system with the principles I outlined just in mind. And 3, we've got to fix our education system. We have pounded it hard. We'd be very proud of Minnesota's place over the last 8 years in the education reform discussion and also our results. We were the first state in the country, as I mentioned, to offer school districts performance pay for their teachers. Now everybody else is scrambling to do it. In fact, some states have caught us in certain cases with even more aggressive forms of it. And our results are really good, like our ACT scores are #1 in the nation. and lots of other big scores like that, except if you're a disadvantaged child. You come from an area of disadvantage, a concentrated disadvantage. Then the results aren't so good. This has been true all over the country for lots of decades. We have a system now where we manage to what? Time. How many years have you been in school? 12. What is our expectation for a mostly time on task? We need to switch the system from the variable being outcomes and performance and the constant being time to having the constant being outcome and performance and the variable be time. That's a complete 180-degree flip from what we do now. This future will not unfold quickly and it will not unfold easily because the guardians of the status quo, who both culturally and politically like the way it is now, will not let go of it easy. But mark my words, 20 or 30 years from now, there'll be a group in a room like this talking about a whole different education system. You'll see it first. In fact, you're already seeing it at the higher education level. But the current system we have is unsustainable both financially, but it's also unsustainable in terms of the forces of technology being unleashed and disrupting it in ways that I think are going to be very constructive. So what does that mean? We still need physical places for socialization, sports, and the like, but we need to be able to customize the learning experience for students using significantly more technology than we do now. And whether that's delivered in the home, whether that's delivered on the internet, whether that's delivered in the classroom, whether that's delivered in 1 month, whether that's delivered in 9 months, the speed, the content, the style can all be geared towards the student's aptitude, interest, learning ability, learning style, and what we should measure and hold schools accountable for and providers accountable for is outcomes. So if Kramer can get to 4th grade math in 2nd grade, let him go. I don't mean by hanging out with the 4th graders, I mean by showing up in 2nd grade with the demonstrated ability to pass what we expect a 2nd grader to know in math. He may have learned that from his parent, he may have learned it at math camp over the summer, he may have learned it using the math equivalent of Rosetta Stone, he may have learned it from his parents, whatever it is. But if you show up at 2nd grade and you demonstrate the competence we expect of a 2nd grader in math, move on. If you do it in 2 months, great. If it takes you 2 years, then we'll work with you. But again, the concept here is to flip the whole system from having the constant be years and seat time to outcomes and have the variable become time. It's a very different model. And then lastly, we're going to have to tackle more successfully our energy needs in the country. We can't, for the indefinite future, have a country that is this dependent on volatile sources of energy, both in terms of supply and price. We need to Americanize our energy sources. There's a lot under the hood underneath that statement, but both from a national security standpoint and from an economic security standpoint, we would be well advised to continue down the path of doing all we can to Americanize our energy sources, produce as much of it here as we possibly can in whatever form is economically rational. It'll bring us new investment, it'll bring us new jobs, but importantly, it will also continue to separate us from people and places and organizations who want to do us great harm. And I think that's the 4th strategic pillar. So it's cost overall, healthcare, education reform, and energy reform. Thanks, you. I'll be happy to take your questions, but I want to thank you for what you do as members of the Chamber of Commerce. The good people who serve in the legislature, regardless of party or perspective, are well-meaning people. They just don't all have, well, hardly any of them have business backgrounds. You know, it's got to the point now where the lawyers don't even want to serve over there anymore. It's increasingly filled with former campaign aides and political activists and government employees on leave and retired government employees who are on leave and on pension. It's very rare that you see many people who are actively engaged or recently engaged in the private sector in any robust way who show up and say, you know, I want to be in the legislature. There's some examples of that, but not a lot. So the value the Chamber brings to the discussion is to pull alongside those individuals in eggs and issue meetings, in meetings in their office, bringing them over to your place of business, and advocate and educate about why this is important. And if we don't have a state where people want to grow jobs and invest all this other stuff about how we're going to fund the latest, social service idea of the month is going to go out the window anyhow. So job one has to be having a strategic perspective that says, first and foremost, we are about creating an environment where actual employers in an actual private economy with actual money that's not provided by the government would like to build something in your city or in your county or in our state. And Minnesota's story over the last couple of years has been this. We have the 7th lowest unemployment rate in the country. Our growth since the crash is one of the top states in terms of job growth over the last 12 months. So if you look post-crash, we're actually doing significantly better than the country on average and in most other states. That's in part a sign, I think, of companies saying, it's at least not getting worse, and hopefully it's getting better here. If this thing turns in a direction where somebody comes in and says, now we're going to crank it up and put more burdens back on, reverse all of what I just described, and going back to government-centric models, that will have a measurable and consequential effect on Minnesota's economy. And I'm in these discussions with business leaders all the time in our state, and I can assure you of that. So I hope you will continue to be advocates for a pro-jobs state. We need it, and I'm grateful for your leadership and your participation. If there's time now, I'll be happy to take questions. Thank you very much. What time do you want to be on here?
Governor, I think the governor said he has to be back on the road by 1 o'clock, so we've got about 15 minutes, and the governor will welcome questions.
Yeah, just shout them out from wherever you are. I can hear them.
I have one.
Yeah, go ahead.
I appreciate what you said about health costs and asking physicians about quality control and Obamacare. I was just curious what you thought about reforming the idea of pre-existing conditions.
There are some parts that I think there could be bipartisan consensus on. You just named one. I think telling people that they can't get insurance because they were previously sick is not right. So having a prohibition on pre-existing conditions is a good thing. I think portability is a good thing. I think lifting or relaxing lifetime caps is a good thing. So there's some things that I think we all could have agreed on, and those are some of them. And some of them are in there. But the bigger picture is you're not going to have this big, huge part of our economy move into Washington, D.C. They're going to do what they always do. They're going to overpromise. The costs are going to go up, and now you're going to have a government-centric model in a world that doesn't look like a bureaucracy. It looks like an iPhone or an iPad. And you want to see the future. I mean, just two icons for the future, whether it's education, healthcare, anything else. Play around on an iPad, or go talk to the DNR. I mean, it's a very different world. I shouldn't pick on the DNR. I can pick your. Governor, yes.
First of all, I want to say, when this group gets together in 20 years, as you had suggested, I hope that they invite former President Pawlenty to the meeting.
We're not going to say it, but thank you. If that were ever to happen, I promise I'll come back to you soon. And we'll have dinner right before a wild meeting.
And my question is it too late for us now with Obamacare? I mean, has it gone to where we can't do anything about it?
No, it doesn't fully get implemented until about 2014 anyhow. And in the meantime, it comes in increments or installments. I can tell you with great confidence, and I don't mean to make this a political speech, that's not why I'm here, but the control of the Congress, at least in the House, is certainly going to change in 2 weeks. And the Senate will get close and maybe even change as well. So I don't think they're going to be able to make it worse, but I think with the President being a big advocate of that piece of legislation, I can't imagine he's going to repeal it. But again, keep in mind the bulk of it doesn't kick in until 2014, so I think there's probably some time for some other adjustments between now and then. I mean, it's just, it's again, I don't mean to make it political, it's just a different worldview. I mean, you got one group of people who It understands a role for government in certain areas at certain levels, but it's a kind of a market perspective versus a government perspective. It's a very different philosophy. Yes?
What would you tell your successor is the most important thing that he needs to do in order to improve the business climate further in Minnesota?
You know, Minnesota had, the question from Susan was, what is the most important thing to do to improve the business climate in Minnesota? I think there are two things. Okay, to give me one. Everybody jumps to the corporate tax rate, which is, and I've talked about this a lot, one of the highest rates in the country, one of the highest rates in the OECD. But you should know that that differentially impacts companies. So if you just look at the rate, it's really high, and it is, and it needs to come down. I proposed, I think, 2 or 3 times in the state to knock it down anywhere from a third to half or eliminate, I can't remember. But so, you know, I've been down this road before. The Democrat legislature would do it. One of the reasons it doesn't cost you very much to reduce is because the exemptions and deductions underneath the rate mitigate the rate. And so Ernst & Young, I think, came out with a study showing when you factor in all of that, it's not quite as dramatic and dire as the sticker price on the rate. But number one, cut the corporate tax rate. Keep in mind, though, that most of our job growth comes from small and medium-sized employers. They're organized as pass-through entities. So they don't pay the corporate rate, it doesn't apply to them. So if you want to have a corollary, not just for the large publicly held C Corps, but you want to have a similar treatment for the pass-through entities, which also have high rates, they're paying at individual rates, then you should create an exemption for them for active business income on their individual returns. I would also create a preferential rate for capital gains in Minnesota. We don't have that. We tax capital gains as ordinary income. That's really stupid. I mean, it's just not a good signal to send to the market. Anybody who's got a good accountant, you know, figures out how to get around that by moving. We want to encourage people to stay, grow, not move. So those are 3 that come to mind. I mean, longer term, this healthcare issue will break the bank. I mean, three-quarters of the state's budget is in 3 categories: K-12, higher ed, health and human services. K-12 needs structural reform badly, like I described earlier. Higher ed will as well, but that's going to take care of itself to some degree because technology is going to blindside them in ways they don't even see coming, and they're going to be forced to change, frankly, pretty soon. But this HHS part, health and human services, used to be 15% of the budget, then 20, now 25, 30. It's going to be 3/4 or 80% of the budget within 15 years. It's just out of control. And so one of the main reasons we have a budget deficit, you might think, well, we have less money than we have currently. That's why we have a deficit. We have a deficit because the spending that we get benchmarked against for the upcoming 2 years is projected to go up 17% on autopilot compared to the state expenditures in the current budget cycle. Most people don't know that. They hear this large deficit number and they're like, whoa, the revenues dropped, and they did drop, but the larger story is on autopilot, our state budgeters, based on previous decisions by the legislature, says spending, some big blocks of spending are going to be adjusted automatically on autopilot before one vote is cast, before one person shows up there next January, and that's projected now to be a 17% increase. That's paid for under the forecast. But if you want to cut taxes, then they say, well, how are you going to pay for it? You know, you see the incongruity. Why don't we forecast tax cuts every year? Why don't we build that into the forecast and say that every year there's going to be a 3 or 5 or 7 or 10% reduction in taxes and bake that into the forecast? So one of the things I think would be helpful to the state is have a budgeting model that doesn't build in increases. It says we're going to define whether you have a deficit or not, or a surplus or not, based on the levels of revenues that you brought in the door currently, and you have to benchmark against that, not some baked-in increase. Yes?
Well, as you move on to a national agenda and hear about national jobs, what are your thoughts about repatriation of money back into the U.S. at 35% tax rate for money made offshore?
This is a great idea. Thank you for raising it. The question was repatriation of foreign income by American companies. So if you are a global corporation and you have foreign income, if you bring it back to the United States, it gets taxed at a 35% rate, which is extraordinarily high. And so guess what they do? They don't bring it back. So, I mean, and then of course you got all the demagoguery around it, that happens in the political arena. But I think a very smart thing for us to do, and by the way, if you bring it back and it creates any revenues at all, that's not in the current forecast. So it'd be a windfall to the government and to the country. So you could do a number of things. You could say, you can bring it back tax-free as long as you double your employment in the United States. Or if you bring it back and do something with it in terms of R&D or job growth or something, to give you a much lower rate, 5% rate or something like that, it would be an incredible stimulus to the country if you brought even a half of that money back in and redeployed it in the United States. It'd be a huge, it would cost the federal government nothing. It would be, I think, a wonderful idea. Yes?
What do you think the future of ethanol is?
Well, at the moment it's stable, but I think in the future it's going to have to experience a technological breakthrough. So the question was about ethanol, and there's been an evolution of the technology. It's gotten incrementally better over the last 15 or 20 years. In Minnesota, we don't have producer payments anymore to the ethanol plants. So we're keeping our obligations that we have, but we don't have any new producer payments. The federal government does. But I think the future of ethanol is going to, in terms of its growth, is going to have to be supplemented by the ability to move from what they're doing currently to a fuel source that's more of a byproduct or waste, like corn stalk or corn stover or switchgrass or algae or any number of other things. Otherwise, I think it's going to continue to be a slow or plateau pattern. And there's a lot of great people working on it. As you probably know, it's called cellulosic ethanol. There's some wonderful little pilot projects around the country, million-gallon plants here or there, but nobody's been able to bring it to scale. But there's a couple of really promising companies, one of which is in southwestern Minnesota, that if they can bring to scale commercially what they say they're going to do, it'll revolutionize the industry. So we need, it's okay, it's chugging along, but it needs a technological breakthrough. Yes?
I know that there's a lot more important issues out there right now. However,
Talking about red fire?
actually, I was going to say, what are the chances of the Vikings getting the stadium before Favre really retires?
So in 10 years. The question was, what are the chances for a Viking stadium? On my watch, we did 2 stadiums. One was the University of Minnesota. Of course, we were told if we got that new stadium, we're going to era of glory for the Gophers, winning teams, the stands would be filled. It's a beautiful stadium, but I didn't have a heart burn over that one because it's a public institution and put some public money into it for a public institution like the University of Minnesota. I thought was fine. We partnered with Hennepin County and the Twins to authorize Hennepin County to put the deal together with the Twins. The Twins and Hennepin County paid for the whole thing. There's not any state dollars at the Twin Stadium, but it's been a roaring success. So now you come to the Vikings, and just in magnitude, it's different. You put a dome on it, even with the depressed construction costs, you're in the $750 to $950 range, maybe $1 billion, depending on how many bells and whistles you want on it. And the Vikings have indicated they pay a quarter of it, and the league will maybe kick in some money, and the rest is going to have to fall somewhere else. So in concept, number one, I would say we value and appreciate the Vikings. They are a tremendous asset for Minnesota, and no thinking governor, no thinking legislature is going to allow the Vikings to leave Minnesota because it's a cherished asset we want to keep here. But we got to figure out a way to do that that doesn't offend everybody's philosophical limits and policy limits and financial limits. I think that it'll get done. It's obviously not going to get done between now and January. There's no session, but I think you're going to see a big debate about it in the next year or two, probably this next session. But I will just say I think it's highly likely to get done.
Hey, can we add an addendum?
Because it has to.
Bring them to St. Paul?
The Vikings? Well, I've had a lot of discussions with them, and one of my favorites was with Red McCombs. When he went into the Metrodome, he said, "Governor, I can tell you, this is after he first arrived in Minnesota, I can tell you right now what's wrong with the Metrodome." I said, "What, Red?" He said, "Well, at halftime, if you're a customer, a fan, you got to choose between peeing and eating." He said the lines are too long, the quarters are too small, and you got to choose between going to the bathroom and buying something. He said it's killing our revenues. And so we got to be able to do both. But I think the bringing them somewhere else would have value in terms of the discussion. But the Vikings very much indicate they want to be in downtown Minneapolis. But as you know, with all these things, they're negotiable.
Governor, perhaps one more question?
Yeah, okay, yes, we'll go over here.
I'm a student nursing at Rasmussen College, so I spend with both the higher education and the healthcare perspective. And you mentioned 5 different healthcare conditions, and I'm wondering where Minnesota is going to be more proactive in prevention and preventive medication, telehealthcare, and then adding or including more college students into decreasing the preventative care that we currently have.
Well, let me start by giving you some brief history. Minnesota, of course, is one of the first and most intensive states to go into HMOs. This dates back to the early 1990s, late 80s to predecessor form. And the proposition of HMOs was, for a fixed amount of money, we're going to take care of your employees or your patient population, and there's going to be tremendous emphasis on prevention. We're going to send out newsletters. We're going to do preventative care. We're going to take care of these maintenance issues that are going to save costs down the road. And they took the early, low-hanging fruit. But if you look at the healthcare outcomes of that model over a period of time, they didn't improve. In fact, in most categories, they got worse. In the chronic categories, they got worse, particularly as it relates to heart disease, obesity, diabetes, and the like. So we're taking a little different tack now. We continue to want to emphasize prevention. But when you get into chronic care management, at the early stage, even at the early preventative stages, there are some treatment protocols that are just dramatically better than others. Diabetes would be one example. So if you look at people who have type 1 diabetes or type 2 diabetes, as it defined by optimal care by a place like the Mayo Clinic, best in the world care, early on there was about 6 or 7% of the diabetes patients in Minnesota that were getting optimal care. So we have this program in Minnesota called Bridges to Excellence, where we now identify what optimal care is, and we're offering bonuses to providers to get increasing percentages of their patient load to levels of optimal care. And if you do that on diabetes, then you likely prevent all kinds of other very problematic and severe healthcare procedures from undertreated or mistreated diabetes, including amputations, organ failures, and the like. And so we're very fortunate in Minnesota because we have this group called ICSI, Indian Institute for Clinical Systems Improvement, that is a Mayo Clinic derivative that is well regarded. So a lot of other states, they say, well, who are you to tell us what the best treatment protocols are? I'm a doctor, I'm an artist, et cetera. And we have the credibility of the Mayo Clinic behind these measurements and protocols, or the ICSI derivative of the Mayo Clinic, and it helps a lot. Okay, and I'm going to say, close on a positive note. Minnesota is a great state. It is filled with really good people. It will be successful. It will only be successful if our good people stay involved, as they always have. But we need people who are concerned, who are informed, who are experienced, who have good judgment to be involved in the political or public policy process. Because if good people throw their hands up and say, what difference does it make? It's unfixable, or it's too difficult, or it's mindless, it's not worth my time, then the goofballs take over. And we need you, so please stay involved, and good things will happen. Thank you very much.
I don't think it'd be fair, particularly with the cream of the crop of the city of St. Paul and the East Metro, as manifested by the St. Paul Area Chamber of Commerce coming here, without asking the governor to give us a little bit of a prediction as to his future plans. I can think of no better time at least give us
I was remiss in not recognizing Matt. You all know that he was the chief of staff in my office for several years, I think, or 2 years. Three? But he did a great job, and if you don't know him, you'll get to know him. He's a very earnest person, and he's a smart person, he's an effective person, but he's sincere, and he's authentic, and he's transparent. And I think as a leader of an organization that has lots of different constituencies, stakeholders, you have to interact with the legislature and others, members, I think you'll find his leadership style not only effective, but welcoming and open. He's a good guy. And as to my future plans, I'm going to open a margarita bar in South Florida. I just say I'm being president of the youth soccer club in Egan.
Ladies and gentlemen, thank you for attending our Political Leadership Luncheon Series. We'll call the luncheon over. I would remind you that our Chamber's Honor Gala is coming up on November 4th at the Landmark Center, so take a look at the Chamber's events webpage. Thank you so much for coming today.
See you.